Today's discussion is about cocaine, its misuse, and health risks associated with cocaine, as well as some treatment options to refrain from use to help obtain and sustain sobriety. Who knew a cocoa leaf grown in Bolivia, Colombia, and Peru, then grown in labs, can lead to an array of mental and physical health issues? Cocaine, it has many street names such as blow, coke, crack, snow, soda cot, is often distributed in white crystalline powder and can be diluted. In other terms, it can be cut, mixed with a variety of substances such as fentanyl, methamphetamine, and xylazine. If you're not familiar, xylazine is a tranquilizer often used in animals, such as a horse tranquilizer. They are actually mixing these items, these substances, into cocaine to stretch it. So stretching it means they're producing more. So it increases the profit for the dealer while discarding the health impacts it has on the consumer. So there are multiple routes cocaine can enter the body. The origin of the route changes the effects of the cocaine on the body. For example, smoking or intravenous use, which is through IV, reaches the brain in a matter of seconds. It produces a rapid onset, a euphoric feeling, so a happy effect. The rush to have more energy, feeling more alert. However, this effect wears off really quickly, then leading to a crash, feeling depressed, feeling down, which often leads to misuse because you want to feel normal again. So snorting cocaine, it has a less intense effect. It's a slower buildup in the brain. Once it does reach the brain, it increases your alertness. One may feel restlessness, irritability, anxiousness. So it's important to note that the tolerance to cocaine happens rather quickly, leading to one needing to use higher amounts to produce the desired effect. Hence the term, one is chasing the dragon. So you probably heard that term, chasing the dragon. This really means they're trying to achieve that initial rush again, that same feeling they felt the first time they snorted or had cocaine through IV use or through smoking. It's important to note also that using higher doses of cocaine for an extended period of time, like binging, can lead to paranoia, a lot of mental health issues, physical exhaustion, issues with sleeping, depression, other physiological effects on the body, increased blood pressure, increased heart rate, dilated pupils, insomnia, inability to fall asleep, staying up all the time, loss of appetite, which means you're just not eating, you're smoking a lot. They're chasing the dragon, so they're constantly looking for their next high, which that term looking like a crackhead has come from, because you're not eating, you're losing weight, you're not looking like yourself. So those are some of the physical effects you may see on the body. It can even affect respiratory problems because of the nasal cavity. If they're snorting cocaine, it can impact the nasal cavity. Again, heart conditions, cardiac arrest, convulsions, stroke, and even death. Cocaine has many negative impacts on the heart due to the increased amount of oxygen needed by the heart. Cocaine stimulates the heart to beat faster and beat stronger, but it also decreases the blood flow to the heart muscle or block it completely, which leads to a heart attack. So cocaine stimulates the brain reward system. The reward system in the brain is where we have dopamine, a feel-good chemical receptor. It's where we get our feeling of sensation to the reward system, where when we do things that make us happy, that we get a lot of dopamine on board. So it causes a dopamine buildup. The buildup causes an extra sense of pleasure for a short period of time, which makes the brain want to repeat this feeling, this pleasure, which again makes you want to use more and more cocaine to get that same effect. So in the United States, cocaine is actually a controlled substance, a Schedule II drug, which means it has a very high potential for abuse. However, it also has been accepted for medical treatment in the United States, primarily as a topical anesthetic or for procedures involving the upper respiratory tract. It can also be used to reduce bleeding in the mucous membranes in the mouth, in the throat, and the nasal cavities. but I will say it's very rarely used in the United States for medical purposes, but it is a controlled substance used in the correct environment. It is a Schedule II drug, which means it can be used properly in a controlled environment. So let's discuss some treatment options. Residential treatment. Residential treatment can provide, residential substance abuse treatment center can provide a safe, structured environment free from illicit substances, which allow the body and the brain to refrain from continued use, allowing the brain and the body to recover while also gaining tools and support from mental health practitioners and staff to refrain from future use. You can also receive psychotherapy, which is talk therapy. It's beneficial because one can learn behavior modification and cognitive behavior interventions to assist with refraining from further cocaine use. Narcotics Anonymous is amazing. There are many Narcotic Anonymous programs within every neighborhood to help provide support and recovery tips. Celebrate Recovery. This is a Christ-centered, faith-based recovery program in local churches who also provide support and recovery. While there are currently no FDA-approved medications specifically for cocaine addiction, there are many medications that we can use as providers off-label to assist with managing symptoms that's associated with cravings and sensation. So for one who may be addicted to cocaine or misusing cocaine and not having the ability no appetite to eat, we can provide medications to help stimulate an appetite. For example, if we can prescribe some medications to help decrease your craving for cocaine. It targets that same receptor in the brain. We can provide medications to help you get some sleep. So there's several medications that we can prescribe to target symptoms, not necessarily specifically for cocaine use. So engaging in illicit or recreational drug use can be a very slippery slope. If you or someone you know may be struggling with the misuse of cocaine, I encourage you to contact a treatment facility and speak with a licensed mental health and addiction provider to assist with creating an effective treatment plan to help you achieve sobriety. Thank you so much for listening, and as always, I hope you have a great day.